Dr. Slasko is going to discuss a very common pediatric problem. Someone notices a lump in the neck.
So this is one of the most common things that gets sent to pediatric surgeon. You have a child who mother notices a lump in the neck, or maybe the pediatrician notices a lump, and there's concern about what it is, and so it comes to us. Well, basically, there are 3 or 4 types of lump in your neck. And each one of them requires a slightly different approach. If you have a little baby who has a lump in the side of their neck, sometimes a rock-hard lump, and it's in the area where their sternocleidomastoid muscle is, a muscle that goes from your sternum to your clavicle and joins with the mastoid, which is the part of your skull right behind your ear. It's the muscle that you can see in someone skinnier than me that comes down in this direction. Sometimes in the middle, right in the middle of that, a 3 or 4 week old baby will have a rock-hard mass. That is almost certainly something called torticollis. You may notice that the baby looks all the time in the direction opposite the mass. We think that that's a problem from birth trauma, where there's an actual little tear in the muscle, in the sternocleidomastoid muscle, and the baby makes a scar as it's healing, and that shortens the muscle. It causes the baby to turn the neck. It's a rock-hard mass. People become concerned that it might be some tumor. In fact, it's called a fibrous tumor of torticollis, but it's something that's completely benign. And what we do with those is we see the baby. If we can be sure that the mass is in the sternocleidomastoid muscle, we just send the baby for some physical therapy. We teach the mother how to do exercises to twist the baby's neck, and the vast majority of those just get better by themselves over the course of time. In older kids, masses in the neck sort of fall into 2 or 3 categories. There are kids who have lymph nodes that swell up, what sometimes people call glands. Now the thing is, every person in the world has lymph nodes all over their body. It's where the immune cells, the cells that fight infection, hang out in your body. It's where the immune cells are collected until they're needed. Children who have never been exposed to various viruses catch a cold from their friends, catch a cold in the world, get infections, and what happens is their immune system responds very, very dramatically. And those lymph nodes get large and swell up. So it's very common for a small child who gets a sore throat to have big lymph nodes in their neck. Or if they get an earache, to have big lymph nodes in the back of their neck. Or if they have a cold, or if they have a toothache. There are countless reasons to have lymph nodes swell up. The problem for pediatricians and the problem for pediatric surgeon is that there are also serious diseases that can involve the lymph nodes. There's a kind of tumor of the immune system called lymphoma, which may present as a swollen lymph node. And so parents and pediatricians become concerned when they see a lymph node that's in a patient's neck that they hadn't noticed before. And the question arises, well, should you biopsy it? Should you do an operation to take the lymph node out to allow pediatric pathologists to look at it and decide if it's lymphoma or not? Well, the answer is that there's no absolute answer. We try to use common sense. If I operated on every child who had a palpable lymph node, a lymph node that I could feel in their neck, I would be a very wealthy man because I could operate on every single child. Every child in the world has lymph nodes in their neck that you can feel. So what we do is we try to ascertain how long the lymph node has been there. If it was there since the child had an earache 2 weeks earlier, it's almost certainly related to the earache. If the child is teething, it's probably related to their gums. If a child had a sore throat, it's probably related to their sore throat. So if a lymph node is palpable and appears fairly suddenly, that's usually a sign that it's related to an... So if a lymph node gets large suddenly, grows quickly, it's almost always related to an acute event, an infection. And so a lymph node that just appears suddenly and is very large, we usually would wait a few weeks and see if it starts to shrink. The actual size of the lymph node matters as well. If it's a little lymph node, or if there are multiple lymph nodes clustered together that are fairly small and soft, we usually will wait and see what happens. If the lymph node has been large and then gets smaller and then enlarges again and then gets smaller again, it's also more likely that it's just a reactive lymph node, a lymph node where the immune system is reacting to infection or inflammation. So those are the ones that we would leave alone. It sounds as though I'm joking, but what I say to parents many times is that anything that gets big and then gets smaller again is very unlikely to be something that's bad. If there's a lymph node that's rubbery in texture and is slowly growing and persists when the child has no other signs or symptoms of problems, those are the ones that we find more suspicious. And those are the ones where we'd be more likely to biopsy it, to schedule an operation, to make a little incision over the lymph node and take it out. Now, in addition to lymph nodes, there are other little masses that kids get in their necks. If there's a mass that's in the midline of the neck, anywhere from the chin right down to the sternum, especially one that has any drainage coming out of it, but sometimes it's just a lump, what we think about is something called a thyroglossal duct cyst. Your thyroid gland, which is a gland that's in your neck, forms from something called the thyroglossal duct. It's actually a little opening at the back of the tongue. And as a baby develops, inside its mother still, the thyroid gland comes down and descends to its normal position in the neck. And sometimes that descent isn't quite normal, and it leaves behind a little connection that forms a little cyst that fills with fluid and makes a lump in the neck. Now, if there's a thyroglossal duct cyst, in other words, if there's a swelling in the midline, then we always recommend an operation. Thyroglossal duct cysts connect to a little opening in the back of the tongue, and they have a high risk of getting infected. And once they're infected, they're very difficult to operate on. So if we can identify them before they're infected, we schedule an operation. It's called a cyst trunk procedure, where we take the cyst, remove it, and follow it up to what's called the hyoid bone, a little bone high in the neck, and take out the center of the hyoid bone, which is where the track, the opening to the back of the tongue goes through. There's another kind of cyst that commonly occurs, and this one occurs along that sternocleidomastoid muscle, the muscle from the sternum, sterno, the clavicle, cleido, mastoid, the bone behind your ear, the muscle that comes up like this to the neck. If there's a little swelling or a little draining sinus along the front edge of the sternocleidomastoid muscle, it may be something that's called a branchial cleft remnant or a branchial cleft cyst. If you think back to pictures you've seen of developing embryos, they look like a fish at a certain point. It looks as though there are little gills. Those aren't actually gills. They're what are called branchial clefts and pouches, and they form the structures of your neck and your head and your face. So your jaw, the glands in your neck, the muscles in your neck, all form from those branchial pouches and clefts and the branchial arches. Sometimes a little fragment